The next question, the member for Don Valley East.
Thank you, Mr. Speaker. For the Minister of Health, there's a fundamental principle in emergency medicine that says following any major trauma or accident, patients have a 1-hour window in which the right care means the difference between life and death. That hour is called the golden hour, just 60 minutes to save a life. Yet under this government's watch, millions of Ontarians are being denied and robbed of their golden hour by the Premier and the Minister of Health. Under their watch, we've seen 911 calls go unanswered, ambulances dispatched too late, rampant and unpredictable closures of emergency departments, nearly 900 in 2022, and almost 500 by last August, and it's only getting worse. While the RCMP has rightly launched a criminal investigation into the Premier's Greenbelt misconduct, we are watching yet another scandal unfold in this government's mismanagement of healthcare. When will this government do more than lip service and take a single concrete step to reopen shuttered emergency departments across this province?
The member for Eglinton Lawrence and Parliamentary Assistant to the Minister of Health.
Thank you very much, Mr. Speaker, and thank you to the member opposite for the question. I love to talk about all the great things that our government is doing to improve health care in Ontario. Last year, health care spending in Ontario increased by over $2.7 billion, and that was just last year, and that was just the increase. And this government has increased spending on health care $16 billion since we came to office. To be clear, our government has, on average, increased health sector spending in Ontario by 6.1% per year on average, a much better record than the former Liberal government. Our government knows the status quo is not working. That's why we are taking initiatives, why we are innovating, why we brought in our community and surgical diagnostic clinics, which we're expanding to. We're getting it done so the people of Ontario can get the health care that they deserve.
Supplementary question.
These things have done anything to keep ERs closed and have ignored entirely the root causes of what we're facing. Because right now, patients cannot get access to primary care. They can't get access to family doctors and family health teams. And when they try and get out to nurse practitioners, many of them can only be accessed by paying $400 mandatory subscription fees. This is about doing things like dropping the appeal of Bill 124. And putting in the work to retain healthcare workers with proper wages, benefits, and mental health supports. This means regulating temporary nursing agencies. It means investing the billions of dollars this government is instead stashing away in contingency funds. And we cannot afford to fail on this. In September, 3 teens were stabbed at a house party in the middle of the night. Rushed to the nearest emergency department, they found that it was closed. And in the last month, there was a 10-day period where the emergency department in Chesley, Ontario was open for only 10 hours. What does the Minister of Health say to the people of Ontario who live with the anxiety of not having an emergency room open in their times of crisis?
Deputy Premier and Minister of Health.
Thank you, Speaker. What I will say to the people of Ontario is that we have your backs. We are expanding primary care in the province of Ontario. We are expanding the number of seats available for nurses, for PSWs, for physicians in the province of Ontario. We have programs in place that ensure that if you would like to practice in Ontario, you can do that with new legislation with respectfully, you voted against, that says if you have a license anywhere in Canada, you can come to Ontario and immediately start practicing while you await your Ontario licensure. We have directed the College of Physicians and Surgeons of Ontario, the College of Nurses of Ontario, to quickly assess, expedite, and ultimately review, and when appropriate, license internationally educated and trained physicians and nurses. We have done.
Thank you. Thank you. And I'll remind the members to make their comments through the chair.